Hi, I'm Michelle Nicewinder, partner at Milestones Financial Planning, bringing you this month's practical money tip. Today I'm going to explain the different parts of Medicare, so let's get started. There are 4 parts to Medicare: A, B, C, and D. You are eligible for all Medicare plans at age 65, but I recommend that you enroll at least 3 months early. You know how Washington works sometimes. Medicare Part A covers inpatient hospital stays, some skilled nursing facilities under certain conditions, limited services, certain supplies, and it may also cover hospice care for certain terminally ill patients. If your employer has withheld Medicare taxes from you for at least 10 years, then you are eligible for Part A. Medicare Part B helps pay for some health care costs that are not covered by Part A. So this is usually outpatient services that are either medically necessary or preventative. So Part B is optional, and the premiums are withheld from your Social Security check. But be sure you enroll by age 65 because you'll owe a 10% penalty per year if you start late. There is an exception though. You won't have to pay the penalty if you or your spouse are still working and have group health coverage. Now on to Medicare Part C. Medicare Part C is also known as Medicare Advantage. Part C is run by private health insurance companies and it really is an alternative to Parts A and B. These businesses are contracted by the government and the plans must provide at least the same level of coverage as Parts A and B. Some plans provide even more coverage, such as prescription drugs. Because there's so many choices, you really need to do your homework on which Part C plan you choose. So here's a resource that I recommend. Also, be aware that you must re-enroll in your Medicare Advantage plan at the end of each year. Unfortunately, it's not automatic. You may be wondering, why would I choose Part C when Part A is free? With Parts A and B, the cost is unknown since you pay a percentage for each health service you receive, which is usually about 20%. But with Part C, you'll pay a flat copay for the same service, just like an HMO. But it also means you need to make sure that your doctors are in the plan and will accept Medicare Advantage patients. Medicare Part D is a prescription drug plan. If you're enrolled in Part A or B, you can sign up for Part D. I know, it sounds crazy, but we're almost done. Like Part C, the prescription drug plan is also run by private health insurance companies. Be sure to do research to make sure that the plan you choose covers the drugs you'll need. So there you have it, your A, B, C's, and D's. Next month, I'll answer some questions you've asked about Medicare. And if you have a question, be sure to email it to me. Who knows, you may make my list. Thank you so much for watching. Be sure to subscribe to our channel so you don't miss my next practical money tip video. Until next month, bye.